When I got into therapy, I didn't know what happened. I didn't know what was wrong, but I knew something was really wrong. I think I started having that inkling as a teenager that something had happened, but then when I was 23 and I was suicidal, so depressed, just kept saying to myself over and over, like, I need help. It took about 5 to 10 years for me to really work through the uncovering process. I was in and out of therapy sessions, having memories, and then going into therapy and saying, listen to what I remember now, or now I figured this out. As I started uncovering and having actual memories of being raped, I would get bombarded with flashbacks and body memories. And what I learned was that was my body and brain's way of saying, no, like, you know what happened to you. It took me a while to really come to terms with the fact that it was my dad. I started having flashbacks of he would come into my room and do these horrible things when I was sleeping. He's the one that sexually abused me for a lot of years. Being a trauma therapist is the most rewarding job ever. And I feel like I can't imagine doing anything else. People will say to me a lot, are you crazy? Why do you do that for your job? And I say, there's so much hope when people decide they're going to confront the things that have been holding them back for 1 year, 5 years, 10 years. It's not depressing. It's stressful and it's difficult, but it's definitely not depressing. No person reacts the same. Some people that I talk to, they have flashbacks, but predominantly they have nightmares. Or I talk to other people who they have panic attacks or they become catatonically depressed. Everybody is different in the way that they deal with trauma. There was a situation when I was 18. I went for a run. I always ran every day because I was trying to lose weight. About 2 blocks into the run, I started having horrible cramps, ended up on the street. I don't really remember how, but somebody from down the street came and said, are you all right? I wasn't all right. Called 911. So here's a warning flag right here. So the EMT came to put me in the ambulance. And the first thing I said was, can you not tell my parents? Once I got to the hospital and I was triaged over and over, the doctor kept saying, is there any chance you could be pregnant? Is there any chance you could be pregnant? And then my mom is standing right next to me and I'm saying, I'm not with anybody. You know, I was terrified. At 55 as a therapist, I would want to go back to that memory and go, maybe the nurse and the doctor needed to somehow consult with the team away from Shari and her mom, because there's something going on here. There's a collusion of some sort. All the symptoms I was having was a miscarriage. Nobody did a pregnancy test. They just sent me home. Patients will lie. We won't tell the truth when we don't want to know the truth, or we feel like we could get hurt if we tell the truth, or we're embarrassed, or we think, I'm not going to tell her the truth because she's not going to believe me. So I think it's really important that doctors understand that patients with any type of PTSD or trauma history, they're not going to just come in and be all open and forthcoming. I feel like doctors and dentists need to be trauma informed, meaning they, before starting to work in the field, really understand what are some of the warning signs, what are some things that we need to look for when we're working with, whether they're kids, teenagers, or adults. In an ideal world, what I would say to doctors and dentists is before you start working in the field, maybe take a class on trauma and recognizing warning signs of abuse and recognizing and learning how to work with patients who also have been diagnosed with things like PTSD. To know that PTSD is not something you can see. What are some behaviors that we need to watch out for if someone's actively in a traumatic or abusive situation? When I think about doctors who are having to do different types of exams or tests, sometimes these exams and tests can be intrusive. If you're working with someone and you're saying, we're going to need to order a transvaginal ultrasound because we have to rule out X, Y, and Z. And if either your patient is saying, I can't do that, or I'm afraid to do that, or I don't want to do that, to understand that that doesn't mean that your patient is just being like uncooperative. That's a warning sign right there. You're sitting in the room with a patient who's seeming worried and afraid about a test that is more routine. You may be sitting in the room with someone that was raped. It's not your job as a doctor to do therapy, but you can say to your patients, before we order the test, just tell me, what are you most afraid of? Or is having a test like that, does it feel too intrusive because you experienced something in the past? Being curious about your patients and not just sort of closing your mind to the idea that patients are not just uncooperative, patients are afraid. Patients who have trauma, they don't trust doctors or anybody in authority. So don't take it personally. When I'm working with clients who have a history of PTSD, many of them tell me, I am afraid of the dentist. It can be really difficult to go to the dentist. I have worked with so many clients who have been raped, who say the second they sit in the chair and they lean back, they get leaned back and the dentist leans forward, they start having flashbacks of different types of abuse or things that were done to them. So what I do in the therapy session, because I'm not at the dentist's office, is I say to clients, find out if you can get a name of someone who's trauma informed. For the dentist to say to the patient, knowing that you have PTSD, knowing that you can be triggered when somebody's in your mouth, would it help if I went really slowly? Would it help if I explained? They're not setting themselves up to be traumatized if each the dentist and the patient are taking an active role in making the experience feel safe. I have many clients who won't get mammograms, who don't go for their regular yearly OBGYN visits, who haven't been to the dentist in 20 years. They just are so afraid to be in a room with someone who's an authority figure. I just turned 55. I have an almost 15-year-old child. We have the best life. I am struggling with the things that I've been struggling with my whole life, but the difference is now when I have flashbacks or my world is ending, I go, nope, because you got to go pick Andrew up from wrestling. I have my sanity.
Let me introduce trauma therapist Shari Botwin.
Let's bring in Shari Botwin for more on this.
One person starts to talk about their story, and then it's like a domino effect. It gives permission for other people to then come forward and speak about their own experience. My name is Shari Botwin. I'm a trauma therapist, and I'm also a survivor of childhood sexual abuse.